Hello? Can you hear me? Can you hear me now? Okay, great. This is Joshua Pritikin, and I live at uh, 8074 Thunderhead Avenue in White City. And the reason the reason I'm calling in today is yeah, in response to the Jackson County's August 9th letter about Measure 110. Um, I've been thinking about that for a while now, and I noticed Oregon Public Broadcasting, their website, had a recent article that speaks to this. So I'm just going to read some of it. 3 years, and I've already shared this with the commissioners. I just want to make sure it's in the public record. 3 years after Oregon voters elected to decriminalize drugs, a new study has concluded that the first in the nation law has not led to increased drug use or drug overdoses. The conclusion counters an increasingly common narrative that Oregon's drug problem is unique in the country and that decriminalization is to blame. Our analysis suggests that state decriminalization policies do not lead to increases in overdose deaths. Corey Davis said, an assistant clinical professor at NYU Grossman School of Medicine, and the study's senior investigator said in a statement. Researchers at NYU, the Network for Public Health Law, and the Centers for Disease Control and Prevention looked at 13 states with similar drug overdose rates to Oregon in the 3 years leading up to Measure 110 going into effect. They then compared overdose rates in Oregon to those same states in the first year after decriminalization. Overdoses went up basically everywhere, Davis told Oregon Public Broadcasting. What didn't happen is that they didn't seem to go up more in Oregon after Measure 110 went into effect. The study used a similar methodology to look at overdose deaths in Washington, where in 2021, the state Supreme Court threw out a law making drug possession a felony. Washington lawmakers have since passed a new law making possession a gross misdemeanor. The NYU study only looked at fatal overdoses because that is the most reliable data available. Non-fatal overdose data is difficult to collect for a number of reasons. Reporting standards vary widely across emergency service providers in the country, and hospital data isn't easily acquired. Yeah, so the article goes on in a bit more detail. And yeah, I just wanted to sum up. Drug abuse is a medical problem. To return to the cruel and ineffective public policy of drug prohibition would be a step backward for public safety. I respectfully request the commissioners rescind their August 9th, 23 letter recommending that Measure 110 be repealed. Thank you.